Tufts is considered actually the second largest dental school in the United States. And we have about 200 plus students per each class. Before coming to Tufts, I have never had experience of teaching to such a large audience of 200 students. It is a huge challenge for the instructors to gauge whether the audience is following your thought, is understanding your explanation. So what we have introduced about a year ago with a lot of help from the IT support of your dental school and the medical school is to use the platforms called Learning Catalytics. And with the Learning Catalytics, first thing that we notice is the attendance of the students. We have a very large students attending when we deliver the Learning Catalytics content. And the importance of the attendance as a teacher is that our students can keep up with the content of the lecture in a weekly basis. With the Learning Catalytics, we can actually gauge at the real time all the students who are present in that lecture, whether they are understanding the content of our lecture or not. So if, for example, if I challenge our class with a specific question, and if only 40% of the class are getting the question right, now that's giving me a real feedback at the real time that I can address that issue right there at spot in the classroom. Learning Catalytics offer not only traditional tools of multiple choice answers, but also it gives a tool that you can post a specific image of either patients or even the X-ray images, and the students can pick from their laptop or from their smartphone, any other tablet, to specific regions of interest. So for example, in the periodontology, it's very important for our students to learn how to locate or where to locate the presence of tartar, the calculus, for example. And when we post this X-ray image to our students, they can actually pick the regions where to see the calculus in a specific image. So it really opens up a lot of more options for the instructors rather than the traditional method of asking the question to our students. One thing I realized is a lot of our students will depend on the content of the PowerPoint or limiting their knowledge and the learning experience within the discussion of the lecture. So I encourage each student to actually read updated papers on specific topics related to the lecture. Once they go through their reading assignment, they have this online quizzes that are available through the Tufts platform. They have few days of that week to read and answer those questions. So we are also encouraging our students to keep up with the weekly content and to expand the source of their knowledge beyond the conversation that we had in the lecture room. The other thing is I use the iPad to assist me in projecting the images. As a nature of the dental education, we have to deal with a lot of clinical images or even the X-ray images. If you're simply using a laser point like traditionally a lot of an instructor will do, number one is the audience who's not attending the lecture, they will not see the laser pointer that I'm using in the lecture room. Number two is our students, because they are in their early phase of their education, they are not familiar with all the details of the imaging. So if you simply click with the laser, they may have a little bit difficulty to really locate exactly what the instructor is talking about. So by having this iPad platform to project and to locate the imaging, the points of the area of interest, the students can actually see and understand better what the instructors are trying to show to the students. So as part of the dental education, the students need to learn various techniques for different specialties. So for example, if you have to teach our students about different techniques of brushing teeth, a traditional method would be to describe in word by word what each step of this technique would be. But it would be very difficult for our students to assimilate what that technique is about. However, if we have a video actually showing to our students, it'll be much easier for our students to learn this. And actually in my office, we have a DSLR camera with a tripod, and we can shoot a simple video and upload to our students for their learning process. To be honest, I was not aware of these technological tools that are provided here at Tufts before coming to the institution. So the support and the mentorship of all the staff from the technology, from the dental school and from the medical school, they have been very essential for me to get to know the technology and to implement this technology, because there's also a little bit of learning curve how to utilize in the best way possible. this new generation of students, they have a different method, different ways to learn things from maybe 20 or 30 years ago. So for them to show them videos, to give them tools to interact in this environment, I think they have been very helpful to close that gap between the classroom and the real setting in the teaching practice. To be honest, there's no limit of how much or what they can learn in their lives. So I want our students to have really the basic understanding of all the principles that we teach, and the technology is out there to help us to deliver and to close the gap between the classroom and the patient care, but also for our students to have a self-learning experience in the future so they may continue to learn in this career.